Hello, welcome to week 4. This week we're going to continue going through the BACB guidelines. This week talking about guideline number 3, assessing behavior, and guideline number 4, which involves writing treatment plans. The assessment of problem behavior is the hallmark of applied behavior analysis. In fact, it's what separates what we used to call behavior modification from applied behavior analysis. As we've talked about before, recall that behavior modification really consisted of what can best be described as a bag of behavioral tricks, interventions, timeout, DRO, that behavioral people used. And of course, all of those techniques in their bag of tricks were based on reinforcement and punishment procedures. The disadvantage, of course, was when a behavior didn't change or it came back, then all you were left with is to try new techniques, but often what behavior modifiers resorted to was increasing the intensity of the reinforcers. Sometimes that meant that now those reinforcers had some negative long-term effects, and or increasing the intensity of the punishers. So now we have the applied behavior analysis, which has a completely different focus. And that focus is step 1. Before we write any plans, we need to understand the behavior. And once we understand the behavior, then we develop a plan based on the results of that assessment. So the ethical behavior analyst always begins with assessing behavior and then comes up with a plan. This guideline, guideline 3, assessing behavior, specifies exactly what goes into an assessment. So the necessary consents, conducting a risk-benefit analysis, as we've talked about in the past, when the ethical behavior analyst should consult with other experts. It also talks about the importance of using simple language. This is a pet peeve of mine, and I find it to be a occupational hazard of a lot of new BCBAs, is that because they now are certified to use behavior analytic language, they tend to use it with the individuals that they're treating or the caregivers of those individuals, and therefore no one understands what they're saying. It is absolutely critical that applied behavior analysts be able to explain exactly what they would be doing in an assessment, and to be able to collect those assessment data by using very, very simple language that everyone can understand. These assessments also need to be based on information and techniques sufficient to provide appropriate substantiation of their findings. The ethical behavior analyst also recognizes the limits of behavioral assessments. That is, we have to understand that behavioral assessments are dynamic, not static. So you don't do a behavioral assessment 5 years ago and base your treatment on that. Things change, and so that functional assessment needs to change also. And that's one of the limitations. It's going to be limited on whatever data you have at that time, and that's fine because it's never final. You're always, the ethical behavior analyst is always doing more assessment, always adding. You're always learning something new. The second guideline that you're going to be reading about this week has to do with the behavior support plan, and it specifies how treatment plans must be organized. They need to be written and explained in simple language. It discusses the need for ongoing data collection. That's very important. Again, just like assessment of data really defines what applied behavior analysis is, so does ongoing data collection. We always collect data. That is a critical part of any treatment plan, any assessment that we do, and the guidelines are very, very clear about that. Similarly, we need to understand, the ethical behavior analyst needs to understand, and it's highlighted in these guidelines, that behavior support plans also need to be data-based. That is, they need to be modified as we learn more. So as that assessment is modified, we learn more about the antecedent and consequent events that affect the behavior of an individual. Obviously, then that behavior support plan also needs to reflect those particular changes. All right, so this week, read chapters 8 and 9 of Bailey and Birch, which cover guidelines 3 and 4. Read guidelines 3 and 4, which I've, again, have a copy of the BCBA guidelines, all 10 of them, but you can read through guidelines 3 and 4 of the BCBA guidelines. And the assignment this week is to look again at another ethical scenario, indicate the relevant sections in the guidelines 3 and 4, focus on guidelines 3 and 4, and describe your ethical actions. So this week, and this is in the assignment, but this week the scenario is you assume that you're working as a BCBA, as a consultant to a group home, serving individuals with intellectual disabilities and behavior problems. The home has recently admitted a new client who was living at home, so there's no data. You really don't have any data whatsoever. And he is, in his first week in the home, engaging in non-compliance and property destruction. And so the administrator of the group home is putting a lot of pressure on you to get a plan out within the next day in order to address these problem behaviors. So, what should you do? What are the relevant guidelines in sections of guidelines 3 and 4, and how should you proceed? I look forward to hearing your responses to that question, and we'll be in touch again next week. Have a good week.